welcome Dan.
After that introduction, we're behind schedule again. Good evening / afternoon, whatever this is. How many of you are from Eastern time zone? It's like 6:30 now.
Thanks for reminding me.
I'm the after dinner speaker, I think. And this is kind of a theatrical environment. Well, I am Dan Dunlop, and I am honored to be here. And I appreciate being invited to speak. And I want you to know there are a lot of women out there. Have you looked around? It's incredible. And I want you to also know I'm not intimidated. Last week I spoke at the, I gotta get this right, Executive Women in Healthcare Conference. It was 135 women and me. Literally, I mean, here we have 7 or 8 token men. Last week I was the only guy in the room, and it was fabulous. We had a blast, and I'm more comfortable in this environment. Probably because I have 4 sisters, no brothers. My life has been so much about being surrounded by women that I've had 3 mothers-in-law. Yeah. You don't want that. But I haven't been married 3 times. I currently have 2 mothers-in-law because my wife, her parents were divorced, so we have 2 sets of parents there. But anyway, so I'm grateful to have all these women and the few of you, John, a few men in the room to keep me company. When I was at the Executive Women Conference, I actually had to have one of the AV guys come sit with me just to hang out, just so we could have a little male bonding time. My presentation is not complicated. It is really simple. So, yes, I'm a healthcare marketer. I do this all the time. This is what I live for. I market to women, and I've done it my whole career, because women make all the decisions in healthcare. But I'm not complicated, because I don't think good marketing is complicated. I am a simple guy. You know, if it took a great, sophisticated mind, I would probably not be the one doing it. I'm simple, and I think that helps me see things clearly. And the message I want you to take back, because I know you're not marketers, in the, I guess, purest sense of the word. We're all marketers when it comes down to it. But you're not marketers by profession. But I want you to go back to your organizations and challenge your marketing. Because, you know, there was a day where the world was flat. I know you don't remember that. None of us are old enough. And then we discovered the world was round. And it changed everything, right? You stop thinking the same way when you realize the world is no longer flat. Mostly, you're no longer afraid of sailing straight out of the ocean that you'll fall over the edge like it's a cliff. Well, in marketing, during my career, the equivalent of that discovery has happened. And Tanya talked about it during her presentation, and several other speakers have mentioned it. But truly, marketing has fundamentally changed just in the last 5 years, not to mention the last 10 years. It is different, and I want you to go back and talk to your marketing people and make sure they're changing along with it. Because what I see right now is the world has fundamentally changed, but most marketers sitting in hospitals have not. The world is still flat. And I'm not saying that as a criticism, it's just a reality. I have clients, I have dozens of hospitals that are my clients. And a lot of them have not made the transition yet. So, what is the change? 10 years ago, and again, I'm really simple. 10 years ago, my job as a marketer was to be a professional storyteller. I mean, think about it. I would figure out what the challenge is. We would craft the story that we wanted to tell whoever the target audience was. And then we would find the media vehicles to tell that story effectively. And then start telling the story and then measure the effectiveness of that and tell it again. Maybe tweak it a little bit based on the market research we do. But that was marketing. It really was professional storytelling. And as Tanya pointed out, it was very one-sided. It was us talking at somebody else. But tell me the truth, how many of you are doing this still to this day? How many of you have your organizations where you're talking at women? Raise your hand. Yeah. That's the reality. I need my water. So, the truth is, the new reality, 10 years ago I was this storyteller. I'm still a storyteller. My organization still tells stories for hospitals and health systems. But the most important thing we do today when clients will let us do it, and this is what Tanya was talking about during her presentation, we truly are creators of spaces. We create environments where consumers, predominantly women, can come together and talk to each other and share their stories. So it's not us telling our story nearly as much as it's creating spaces where women can come together and tell their stories to each other and tap into the expertise of whatever client I'm representing at the time. We infuse our expertise into the conversation where there's a resource. We're a huge resource because we're creating this space for them to come and talk and share. And that's what they want. They want community. And we create community. And I call them communities of shared interest. They're focused. These aren't the big kind of communities you think about traditionally. These are focused communities where people have a common interest, whether it's weight loss and bariatrics, whether it's pelvic health, whatever it might be, oncology. Often these are communities where they don't want to be talking in public. They don't want to have a great big public conversation, but they want to talk to other people like them who've had similar experiences. Because that, frankly, is more valuable to them than us spewing content at them, which is what we traditionally do in advertising and marketing. Does that make sense? Thank you, I enjoyed presenting. We're done. I can't believe I haven't clicked a single slide. I hate PowerPoint. So our job is to engage these audiences through these communities of shared interest. And Tanya mentioned in her talk that, you know, her challenge in this meaningful marketing that she's creating is, and I've written it down, to engage healthcare consumers, and I've modified it somewhat, but to engage healthcare consumers when they're not actively patients. And why is that important? It's important because that's how they're going to become your patients. If you can engage them when they're not patients and be of value, be a resource to them when they're not actively your patient, when they're not going through some acute episode, then when they do have a need, hopefully they're going to turn to you. That's the idea, right? So think about community. What do you want from a community? And one of the things I will tell you, one of the really important things, and I have a PowerPoint slide of an ear later on in this presentation, people want to be listened to. They want to share. They want two-way conversation. They want dialogue. And that's where we have failed as healthcare organizations. We have failed historically to bring that equity to the relationship. We need to become listeners as much as we are spewers of great health content. And that content's important. I want you to share your important information with patients and with families of patients and with potential patients. But I want you to spend as much time listening and introducing people who can share information with each other. So is there a market? Of course. I wouldn't ask the question if I didn't believe there was an answer. So 80% of the women online are seeking health information, yet only 66% of those believe that healthcare marketers understand them. Why? Because we haven't bothered to listen to them. Some people are, and you've heard some examples of that already today, but most of us are not. Women are complex, and this is probably frankly, all consumers are complex, not just women. But women are complex, especially moms who are juggling a ton of stuff in their lives. It is very hard to capture their attention through traditional advertising. You just can't throw messages at them and be successful. You need to find ways to engage them and get them involved. And that's what this quote is all about. So you have to dig deeper. And if you can create community where she can come and derive real value, online or in real world, and I'm not throwing the real world out just because I'm primarily focused today on online communication. If you can get them engaged in community, then you have an active audience, somebody you can engage with your important messages. So today, because I'm talking about these very focused communities, I believe one-size-fits-all marketing is dead. It doesn't work. It's a waste of resources. You're throwing your money away. Yes, I am a brand builder. I do brand consulting. There's a place for branding and marketing. But you can build your brand by speaking to very focused audiences. You know, I have hospitals now up and down the East Coast that are clients of mine where we've created mommy blogs. And these mommy blogs bring together women. And it's amazing to see what happens when you give them this opportunity to communicate online. It's remarkable. It's changed my perspective on marketing. But that's how they're marketing their women's and children's services, through these blogs. It's not through ad campaigns. They're clearly seen as the sponsor of the blog, the creator of the blog, but they're not doing big-time healthcare marketing advertising. They're doing community building and using the community to build their brand. Because what's better and what's a deeper, richer brand relationship? The one where a consumer sits at home and sees your TV commercial or your print ad, or the one where the consumer is coming to your online community. It could be your Facebook page for that matter, but they come to your community and they rely on that for good information, and they find other people like them that they can share information with. That's pretty darn compelling. And that's what I strive for. So what should you expect from your marketing team? You should expect them to move from that storyteller that we all were 10 years ago, and we should not just be today, to being a community builder and a facilitator of great communication and sharing, and content generators and curators. But content generation should not come first. That's not number one. Creating the community is number one. Creating these online communities. And we should market. This whole construct that I'm describing to you is about marketing with women rather than marketing at them. And we're really good at marketing at them, and it's fairly ineffective. We need to market with them. Engage, allow for conversation, communicate shared values. When you create a community and you say, we're creating this space for people to come and share and talk, and yes, we're going to infuse it with some great information, it changes the way that individual who comes to that community looks at you. Suddenly they say, wow, this person understands us, this organization, this hospital, this health system understands us. It is creating the kind of community I need and the kind of information and experience I need. They're creating an environment where I can come and feel safe sharing information that I might be embarrassed of sharing somewhere else. That's meaningful. There are some really interesting studies out now about social media and its impact on us. It's kind of biochemical impact on us, a physiological impact. And what's been found so far is that the kind of changes your body goes through when you create a great friend. You know, suddenly you see a friend you haven't seen in ages. That kind of biochemical change that takes place in your body, you experience that same biochemical process when you interact with friends online through social networks. It's amazing. It has that same impact. You get that same rewarding feeling that you get from being in person with those same types of people. So there is a real benefit to being able to bring people together, and they feel the benefit. The way I describe marketing today, I've created this this notion of hive marketing. I think it's the only thing I've ever invented in my life. Hive marketing. And if you think of a beehive, right, there's this oval-shaped hive with bees buzzing around it. It's this central place. It is the hub of the community, essentially. And the way I see marketing today, we create the hive, which is the online communities, and we should have multiple online communities. A hospital should not have one online community. You should have online communities for all different kinds of conditions that you want to address. And you can use different vehicles. You can have 10 Facebook pages for different types of people that you want to bring together. But so you think of the hive, and that's your community that you're creating. Your goal should be to bring these people to the community. Make it as inviting as possible. Bring them to the community. Get them buzzing around and talking to each other. And then what do bees do? They leave the hive, right? They go out. And that's what you want these people to do. Go out and share their stories and tell people, hey, I joined this great online community dealing with pelvic health. Or it can be any type of service. It could be bariatrics, oncology, whatever. But today we're talking about pelvic health. And it's amazing. The kind of conversations we're having, you need to check it out. That's the kind of talk you want to join. And you know what? Memorial Hospital is making it happen. I can't believe it, you know. They're great. And sometimes their doctors are on there and they're having live chats, and it's a remarkable opportunity. That's what hive marketing is about. Then, who's doing your best marketing? They are. This is the future of marketing. You know, and as you get into population health, and this is a little afield from where we are today, but as you get into population health management, and that's what we're all going to be in that business pretty soon, hospitals are going to stop doing all these ad campaigns, marketing specific services. And what they're going to be doing is creating communities. They're almost affinity programs where well people can come and feel a sense of belonging and exchange health information, have great health education, they can interact. And that's going to be what you then market. That's when you see advertising in the media, it's going to be bringing people to your online community. I really think that is the future of healthcare marketing. Most people aren't doing it today. Mayo Clinic is one of the few that I know of who's doing this. But it is the future. And other organizations who aren't hospitals or health systems have already made the leap. We're slow to get there. And that's not surprising. You know, we aren't great risk takers in this industry, and for good reason. So the ear, I promised. That would be ear. Go back and ask your marketing team what they're doing to listen. How are they listening? Because you can't meet the needs of your target audience if you're not listening. And the great thing about these communities, they're listening platforms, aren't they? I mean, Facebook alone. And it's, you know, and I'm not a huge Facebook fan. I'm not an evangelist for Facebook, but Facebook alone, what a great listening platform for your hospital to hear what people are saying. Now, if nobody's saying anything on your Facebook page, which is likely, that's what most Facebook pages for hospitals, and you've seen them, I'm sure, are post after post after post on the wall from the hospital. Come to our screening this weekend. Come to our open house. You know, it's pushing information out. It's not encouraging engagement. And what the marketing teams at your hospitals have to learn is how to encourage engagement, how to make those platforms safe for consumers to come and share information. You know, I was on Mayo Clinic's Facebook page about a year ago for something I was doing. And I looked and I went through 90 posts on their wall of their Facebook page before I found one from Mayo Clinic. And I know Mayo, you know, it's a cliche example, but they are the leaders in the realm of social media and healthcare. And they're doing it right. I mean, people are coming on their page and they're talking to patients and families. It's amazing to see the interaction. That's what you want. You want to have to do as little as possible. You want to create a community and just let it take care of itself and have a life of its own. So one of the things I really want you to think about, and this is a real challenge for hospital marketers, is that you're not talking to a homogeneous audience. There are lots of different groups we're talking to. That's why the one-size-fits-all marketing model doesn't work. So it drives marketers crazy in hospitals when the chief of some division comes and says, I want a Facebook page for my division. Right? Because, I mean, what's the fear? All of a sudden, everybody wants a Facebook page. What's the problem with that? It's hard to manage. It's hard to control. And is there going to be good content on there? Who's going to be in charge? Well, the truth is, there's a good rationale for having different Facebook pages for different services and different for different types of patients that you're communicating with. You know, for instance, I'll use bariatrics as an example. Bariatric patients usually seek out information very privately. They love online. They love going online because it's private, it's safe, they aren't embarrassed. It makes sense, right? Well, wouldn't it make sense that if your hospital wants to be talking to bariatrics patients or women about pelvic health issues, wouldn't it make sense to have a separate Facebook page for them? Right? Do cancer patients want to go on a hospital's primary Facebook page and write about the issues they're having with chemo or whatever it is they're going through, radiation? No, but they'd much rather have those conversations in an oncology-focused Facebook page. Does that make sense? So it's not a one-size-fits-all world. And there are some easy solutions. You don't have to create really sophisticated patient communities, although we all will down the road, and people outside of hospitals are already doing it. But you can do this with Facebook. You can use existing social media platforms to make this happen. So here, and any examples I show you today, I'm not picking on anybody in particular, okay? Because nobody's doing this very well right now. But Reading Health System, I just picked this out because they have a pelvic health program. And I like their website. They have some cool information on there. And I was on there doing research for this presentation because this is not a canned presentation, as you can probably tell. It's one size fits one. So I was on their health page, and I saw they have a thing for email, printing, liking them, or whatever, and Facebook. And I thought, finally, someone has developed a Facebook page for their pelvic health program. So what do you think I found when I clicked on it? Their hospital Facebook page. How disappointing. I'm not even a patient, but I think it's a sin. Blogs are great community building tools. I already mentioned mommy blogs. There are dad blogs out there. And dad blogs are a big trend actually right now. Not so much in healthcare, but in general. This is a blog my company created for Lexington Medical Center in Columbia, South Carolina. They didn't want to do a mommy blog. They wanted to have moms of all different generations comment. And, you know, that's the sweet spot, have that multi-generational messaging. So we created this Every Woman blog. And the way we developed it was we did a promotion. We built a blog. We had no bloggers. We built a blog, did a promotion on the blog saying, hey, we're looking for bloggers, and we want them to come from the community. We want women from the community of varying ages and backgrounds. So if you're interested, put a comment on the blog and tell us why you think you'd be a great blogger. Or go to our Facebook page, and you can write right on the wall of our Facebook page and tell us why you think you'd be a great blogger. And we got dozens and dozens of women writing in saying why they thought they ought to be an Every Woman blogger. And it was amazing. And a woman would put a post on the Facebook wall saying, I'd love to be one of your Every Woman bloggers. And then another woman would say, oh, I know Mary. Yeah, she'd make a great blogger. And before you know it, you'd have 20 people all commenting on why Mary would make a great blogger. And then, as the days went on, they all started chatting and exchanging information. And all this is happening on our Facebook page. It's amazing. It took on a life of its own. And that's what you want. And that's what people do naturally. I mean, the cool thing about this community building, and that is the role of marketers today. It needs to be the role. The cool thing is, it's something that people do naturally. All we have to do is give them a little nudge, and it will happen. And it did with this. We brought in something like 8 new bloggers from all walks of life, different ages. This Katie is a cancer survivor, so she's got a really great story to tell. She's mid-40s. This blog in its first year, it just started. 27,000 visits. Is that of value to you? If you have a pelvic health program and you've got a blog and 27,000 visits happen? That's cool, and those are quality. That's not throwing a TV commercial at someone. Those are real quality interactions, and every time you do it, look, here's the Lexington Medical Center logo. There. But they're not pushing. We're not throwing stuff at them. We do infuse it with some health content. There is some good information there. We have real-world events for these women to come to. But it's not throwing advertising. What we're doing is we're creating an environment where women can come and talk about issues that are important to women. And they love doing it. The most important thing is we had 518 comments in the first year. That's engagement. People are coming on and they're talking. This is Mary Pat. She's a trip. These women, I tell you, the best thing I get to do in my job, when we start these blogs, we have quarterly blog meetings where we bring the bloggers together. We call them blogger brunches, but they're often in the evening, they're wine socials or whatever. But it is so much fun to go to these things. It is a blast. And they are all, people are just so interesting. They're all characters. But here's Mary Pat talking about her life. Just to give you a sense of what's going on.
Hey, I'm Mary Pat Baldock, lean green MP. And I know some of you, Jennifer and Ro and Shannon, who I haven't seen in forever. I started my blog, and it's been about a year. Through my employer, the City of Columbia, started this 12-week wellness program. And I was interested in health is kind of the big thing, because my grandmother came to live with my parents and lived her final days there. She lived for about 3 years. And I went through this midlife crisis at 44 because I'm still single. I don't know how. I'm still single. I have a dog and a cat, and I live with my sister. And I thought, what's it going to be when I get grandma's age and when I have health problems? And I really had this midlife thing. I'm going to take care of myself, and you can only do so much. And so I really dedicated myself to this wellness program. I work with a nutritionist once a week and a trainer twice a week and work out pretty much every day. And I've adapted a plant-based diet, and I didn't eat vegetables until last September. I had these French fries. French fries, corn dogs. And I'm so excited about throwing a salad out with bread up. So I'm still learning how to eat the vegetables, but I kind of stuck with the program. I've lost 78.6 pounds as of today. Yeah.
So that gives you a sense of these amazing women and the stories they have to tell. And you can see how someone like Mary Pat, people would want to talk to her and they'd want to exchange stories. She has a really important story to tell. And she had this midlife crisis and had never eaten vegetables. Amazing. Did you hear her? She said, when we were having this lunch, and this was one of our blogger lunches, not mommy bloggers, but blogger lunches, she ordered a salad. It was the first time she had ever ordered a salad in a restaurant. And she's almost 50 years old. Unbelievable. She does come from South Carolina, so that might explain it.
They watch it.
I said that for you, Mary. We've got too many Southerners here today. All right. Another blog, the Signature Moms blog. We created this for Signature Healthcare. And this is the most successful blog I've ever worked on. Signature Healthcare is in a really rough place. And I mean, by place, I mean physically, their geographic location. They are in a town called Brockton, Massachusetts. Do any of you know Brockton or hear of it? It is high crime, a lot of poverty. Their payer mix is horrible. And when my company came in to work with them, they were in dire straits. And they had no social media program. They had really not much of a marketing program. But they needed to bring suburban moms to their health system. That's what they needed to do. And we created this mommy blog, recruited 8 bloggers from the community. And it's been amazing. This has just been, it's out of control. It already has, it's over 1,500 subscribers right now. And for a blog, for a hospital blog, that's remarkable. That means every time someone writes a blog post on this blog, and we have 3 or 4 moms who write these posts every week, every time one of those blog posts gets written, an e-blast goes out to 1,500 people who've opted in to get that. What great marketing. And they're not getting, it's not an interruption in their life. This is welcome. This is something they've asked for. And it's coming from Signature Healthcare. They had 42,000 visits last year. That's incredible. You can't buy that kind of advertising. And this doesn't cost them much at all. It takes us about 15 hours a month to manage the blog. The women who we recruit write the blog posts, and they don't get paid. They do it because they love it. And they get all kinds of gratification from doing it. But what a great payoff for the hospital. El Camino is another hospital that's done a great job with some of its marketing. I was checking them out online, and I love that they have this Nurse Barb's Daily Dose. They also have, you know, the best thing you can do in marketing is build it around the lives of the audience you're trying to target. Don't make them fit into your life. Make the marketing fit into their life. And that's what they're doing here. Look, I'm busy. Now, I love the example of keeping the facility open until 7 p.m. and having hours on Saturday. That's what we need to be doing. But look, email me, live chat, call me. Here are options. I'm busy. So here are options. And oh, by the way, they're integrating video. If your marketing team is not using video to tell your story, to educate patients, to introduce your physicians, both to patients and to referring physicians, you are missing the boat. Video is my theme for 2013. You should absolutely be doing it. And obviously, look, video is right here. So you got Nurse Barb's Daily Dose. And look, here's Barb's blog. Really friendly photo, easy to read, nice big font. They've got all the things you can tweet or Google Plus or like it on Facebook. They're doing things right. Another health system that's doing some cool stuff is High Point Regional Health System. They're in North Carolina. They have patient blogs. So they have blogs, excuse me. They have blogs for bariatric patients, for oncology patients, and so on. But there's all kinds of opportunities to get your patients involved telling your story. Because they're far better and more credible telling your story than you are. I guarantee it. So are there women who would be interested in blogging about their experiences with your organization? Do you think so? Yes. Absolutely. And man, they're brand ambassadors. Put them to work for you. It is an untapped opportunity, and it is the best opportunity out there. If you decide to go back and tell your marketing people, we should start a blog. A lot of what you're going to hear is, oh, it's too hard, how are you going to generate content? And it is. I mean, if you try to do a blog, and I'm a blogger, it is hard to generate content. It is work. It's not easy. So what you do is, you have multiple bloggers, like the examples I've shown you. Bring in 20 different people who can contribute one blog post a month. Writing one blog post a month is not a big deal. Writing 3 a week is a big deal. So bring them in. You know, CEOs have such trouble at hospitals. I know lots of hospitals have started CEO blogs. You know, they hate it. It's just, what am I going to write about this week? How am I going to come up with 2 or 3 blog posts? But if you have a leadership blog where leaders from throughout the hospital blog, that's something different. Then it takes the pressure off of everyone. Swedish Medical Center in Seattle has done a great job with social media. They're up there with Mayo as one of the leaders and pioneers in this area. And for their blog, I don't know how many potential bloggers they have, but I bet it's in the neighborhood of 70 different people. They have physicians, nurses, all different types of clinicians, patients, family members, you name it. That's the way to do a blog. It takes the pressure off the team, off of any one individual in particular. And one of the cool things about bringing in lots of different people, like I'll use the women blogger example where we had 10 different bloggers, or 8 different bloggers. Each one of them has, what, 300 followers on Facebook? So we bring their followers with them into our community. And these conversations are taking place whether we acknowledge them or not. The Blogger Network, are any of you familiar with the Blogger Network? They have over 3,000 blogs written by women with 55 million readers. This is huge. And I'll just flash some of them here at you. And they're talking about things that are important to the women that you all serve. Talking about organ prolapse. Some of the other platforms that exist right now, Fab over 50. Flourish over 50. Vibration Nation. Are you guys familiar with Vibration Nation? And I want you to connect with the people you're talking to on a very human level. Look, how many of you at your organizations have physician finders on your website? Raise your hand. Okay. Don't ever let this happen. You don't want a ghosted silhouette of a physician. Have any of you seen that before? I'm not making it up. It's real. I took that from a hospital. That is a sin. I don't even think there should be a headshot, frankly. I think there should be a video where you meet the physician. That's the future. What does this mean? This is not no way to meet a physician. Think about selecting a physician is one of the more important things you do in your life. And we do it based on this. And here we don't have a photo at all. We have nothing. Here we have a photo, but it looks like a mugshot. And I'm sure Henry is a nice guy. But damn, who's the marketer at this hospital? They should be shot. It's not Henry's fault. Here, they're introducing the nurse navigator. Look, I mean, she looks friendly. There's a photo of her interacting with someone. Yes, it looks staged, but it's a lot better than Henry's black and white mugshot. But video is the way to go. And people are doing it all over. I want to give Reading Hospital a shout out since I trashed them earlier. No, I didn't trash them. They're using video really well, so kudos to them. I want to show you this, though. I only have about 10 minutes left. So, creating an environment for women to come to and want to take in your information and want to learn what you have to offer takes some work. You have to create that environment. And that doesn't just mean these online communities that I'm talking about. It also means your website and the way you present yourself online in general. And one way to do that is with video. So I'm going to take you to this website if all works. Yes.
What my patients probably don't know about me is that I'm a big Cartoon Network fan. And I think it's because what I do for a living is so intense. So for me to sit down and just laugh at something incredibly silly is relaxing for me. My name is Chitasi Waters, and I'm an obstetrician gynecologist at Signature Healthcare. I first decided to start saying I wanted to be a doctor when I was 7. And then later in high school, my first anatomy lab was when it really clicked for me that I wanted to be a physician. I fell in love with wanting to understand how the human body worked. And for me, obstetrics and gynecology was the perfect mix. From the obstetric side, I really enjoy watching a human life from its very beginnings. And from the gynecologic side, I enjoy talking with women and getting to know them and through them, their life experiences. I'm really there to help encourage them to maintain their health. Those one-on-one interactions where you're just sitting with another human being and trying to help them understand a little bit more about themselves. If I feel like I've accomplished that, then it is good.
Would you hire her as your OBGYN?
Hell yeah.
Damn right. Is that the way you should select your physician, looking at something like that rather than their CV online? Yes. Because it's an important decision. Do you want to see one more just to make sure so I can show you that's not a fluke? Let me see who else we have on here. Okay, I'll show you now. And believe me, the client did not want this guy on video. I'll tell you. They're like, oh, not Dr. Dern. And I was like, he looks cool. I like the look. So I'll show you Dr. Dern. But he's a primary care doc. He's not an OBGYN, just so you know. But I will show you him. Doesn't he have a great face?
Yeah.
I'm Michael Dern. I'm a family physician, family doc. I've been at this for about 32 and a half years with Signature Healthcare. What I hope to do is try to take where technology today is bombarding us with the electronic health record, the electronic medical record, and iPods and iPads, and this pad and that pad, and by the end of it, all the electronics bombarding us. I'm trying to take what was once our noble profession and help slow down what's starting to become a depersonalized industry. And I love 110 Liberty Street with all my heart. You know, people say, but it's so big. I said, yeah, but it's what happens inside the exam room. And so what happens inside the exam room then translates into, if you need a test, you have it right there. I can go down and look at an EKG with a cardiologist and not have to tell the patient, come back, you know, tomorrow to get the results of your test. And it just makes it so much easier to practice and so much better for our patients to have everything right there in the building. It's not just diagnosing a cancer, it's just not making sure the blood sugar is right. It's more than that, taking care of the patient. And after 32 plus years, some of the patients have been with me in my entire career, it is an extended family. So family medicine, family practice, and taking care of the entire family makes for a great day.
What do you think? So one of the keys is when you're interviewing a doctor on camera, you need to ask them good questions, you know, and your marketing people need to know how to do this. One of the questions I would ask every one of the physicians I talk to, and I ask them this at the end when they're more comfortable, I would say, you went into medicine for a reason. Tell me about those days where you go home and you're driving home from work and you're saying to yourself, this is why I do it. This is why I became a doctor. Days like this. Tell me about what has happened on a day like that. And you get great answers. So if you ask them good answers, don't say, where'd you go to medical school, where'd you go to, you know. That's not good enough. One last video, and then I'm going to exit.
Our patients are at the center of our care.
We get to come alongside patients and really make a difference in their lives and really help them with their health and help them feel better.
And the patients know that you care. And they're not just, you know, a medical record number. They're not just someone filing in the room and filing out.
We all are integrated and work together.
And it allows you to be part of a patient's life in a way that no other profession allows.
One piece of information that might surprise patients is that I was an officer in the Navy. I have a 15-month-old, and half the time I don't know what I'm doing with her.
My hope and dream is to become a professional baseball player and be the shortstop for the New York Yankees.
Reading stories together at home.
My 2 children.
I'm a big foodie.
I'm a mountain girl.
I love to cook. Cook it.
I like to cook. Baseball,
triathlons,
tennis, travel, garden.
Soccer, fishing. I believe in giving back to the community.
Signature Medical Group is one of the largest multi-specialty and multi-physician groups.
Well, one thing that I love about Signature is that everyone is underneath one roof.
They can get very high quality care down in the South Shore. They don't have to drive 30 miles into Boston.
It's not just diagnosing cancer, it's just not making sure the blood sugar is right.
After a while, switching from a blood pressure pill can get a little bit stale. But connecting with somebody through a life crisis and being able to help them through that and make it a little bit easier for them and their families, then I've known I've had a great day.
So I've got a bunch of doctors who hated me walking in the door, who now are my friends. You know, they see the videos and they say, wow, you really made me look good. And what we did was we humanized them, right? I mean, this is very human. And that's part of creating that environment